We believe that the recommendations by the Minister's Advisory Committee on Health should be shelved by the Minister of Health, and we're here today to ask him to do just that before the legislature convenes at the end of October. Alberta's health framework is actually very sound. There might be room for improvement, but there's no need to junk the whole system. Medicare will use the next couple of weeks to encourage Minister Zwazdesky to get on with the real work of improving and expanding Medicare here in the province of Alberta. We're asking him not to scrap Alberta's existing healthcare laws or embroil us in yet another exercise that leads down the road to more private healthcare. Because make no mistake about it, the Minister's Advisory Committee on Health and their recommendations is no benign exercise. It was designed specifically to lay the groundwork for more private health care in this province, and while we may have pushed back on that a little bit, certainly the danger still exists.
It shows that consolidation of existing legislation under a new Alberta Health Act is far from mere administrative housekeeping. It has the potential to be something much closer to radical reform. Our legal opinion also shows that the kind of reform envisioned by the former minister, Ron Leipert, and the advisory committee could dramatically undermine the ability of ordinary Albertans to have a say in the shape of their healthcare system, and it shows that far from improving public health care, a consolidated Alberta Health Act could actually erode the foundations of Medicare. In a nutshell, our opinion shows that the road the government seems to be traveling is not a benign one. For those who care about Medicare and believe that it should be protected and preserved for future generations, there is much that could be lost by replacing existing legislation with a consolidated Health Act and very little to be gained. So what exactly does our analysis say, and what warnings does it raise? Well, the findings and warnings can be grouped under two broad headings: democracy and accountability on one hand, and preservation of the public foundation of Medicare on the other. When it comes to democracy, the big concern that our analysis raises about the proposed Alberta Health Act is that it will take the form of an empty shell with all the details to be fleshed out later by the Minister and Cabinet through regulation. The second and probably more troubling finding of the analysis, and that has to do with preserving the foundations of our public health care system. But as our analysis clearly shows, it is not the Canada Health Act that actually protects Medicare from creeping privatization and the encroachment of American-style queue jumping and private insurance. That job is actually and currently accomplished by provincial legislation, the very legislation that the government is thinking of sweeping away and replacing with vague shell legislation. So either this plan to consolidate existing legislation and replace it with an Alberta Health Act, either it's ill-conceived, or from our perspective, or it's designed to conceal the government's real plan to significantly alter our existing healthcare system.
Albertans spoke out loud and clear during the spring and the summer that they wanted their public healthcare system improved, not dismantled. The feedback we're getting here from the government now is that the government seems to just want to stall on the real issues that need to be dealt with in terms of wait times, in terms of acute care access, and access to healthcare professionals in general. And so, with this Alberta Health Act, we think is getting in the way of real reform. So we are launching a campaign here today, which will continue up to the fall sitting of the legislature, to say that this Alberta Health Act should be put onto the shelf until such time that we have a clear vision of where we want to go with public health care in terms of strengthening health care, public health throughout the regions in each part of this province, and not just working with a vague set of principles that only serve to confuse the issue of real health care reform.